Hi, welcome to Angelic Wellness. The heart is, yes, this is in the center of the chest, and it is the one organ we cannot ignore, because the minute that thing stops ticking, we stop ticking, okay? So let's talk about heart health and cardiovascular disease in general. Here are some signs that you definitely don't want to be ignoring, that could be warning signs to let you know that your heart is not healthy, okay? So we're going to start with first just some statistics about cardiovascular disease in general, right? Heart disease or cardiovascular disease is still one of the top killers of humanity in the world. Over 18 million people every year are dying from one cardiovascular disease or the other. So when we talk about cardiovascular disease, in there are heart attacks, we're talking about high blood pressure, we're talking about stroke leading to kidney failure and things like that, right? So we're talking about anything related to this blood vessel, this heart, and the diseases that arises from that. And over 18 million people, that's a lot of people, dying each year from this disease that we know so much about, and there's so many things we can do that is preventable from getting this disease. Okay, so the other important thing to note is that heart disease here in the US, it is still the number one killer, 100 years running. There are 3 conditions that will run the top 3 as far as what are the leading cause of death, but heart disease still remains number 1. And why is this? Why is it that with all the scientific advancement, why is it that with all the new knowledge, scientific breakthrough, we are still dealing with cardiovascular disease as the number 1 killer in the US and in a lot of developed countries? Because the risk factors for developing cardiovascular disease remains unchanged. In fact, a lot of our lifestyle choices is making it even more prevalent for this condition to persist and not go anywhere, okay? What are these risk factors? Well, the most common one we know is just being overweight. Every year we keep getting the statistics that more and more people are becoming overweight. More and more people are becoming obese. More and more people are becoming morbidly obese, which means we continue to get bigger and bigger and bigger. And not just us getting bigger and bigger, but our children are getting bigger and bigger. Our babies are getting bigger and bigger, right? And so heart disease is becoming more and more prevalent, and it's not going anywhere. So we now have to educate even more than before. What are the warning signs that your body is having a heart attack, or is getting ready to have a heart attack, or might even have had a heart attack? Okay, so when we say someone has a heart attack, what we mean is that the muscle, this muscle that we call the heart, has suffered an accident where enough blood supply did not reach the heart itself, and part of the muscle starts to die, okay? And when this happens, well, that heart is sick. It cannot pump enough blood to the rest of the body, which then causes other cascade of events to start happening, right? So the first thing to understand is that how does the heart itself actually get attacked, right? The very simple thing that happens is that we start to eat foods and engage in activities such as stressful activities that are starting to cause inflammation in our bodies. And the more inflammation we have, the more damage we're likely to have inside the blood vessels that supplies our body, and more importantly, the ones that supplies the heart. And as that inflammation continues, your body starts to use cholesterol, which is supposed to be a soothing agent, to patch the areas of inflammation. And as those cholesterol molecules start to bind to the area, well, other blood cells that are passing through now get stuck to that area, and then we start to form what we call plaques. And then what starts to happen is even more inflammation, and at some point the blood vessel starts to narrow to the point where blood can no longer flow through. And then we get what we call myocardial infarction or a heart attack, right? It's basically a blockage of a very important blood vessel that supplies a portion or majority of your heart muscle. Okay, so once this happens, we say someone's had a heart attack, and if we don't get that person to the hospital in time, we are losing more and more muscle of the heart, and someone can die from that, right? So there are some warning signs that you do not want to ignore, okay? Especially in women and patients that are already diagnosed with diabetes, because this group of people do not present with the typical crushing chest pain that we all know is a heart attack. They present with very subtle symptoms, symptoms that don't even make you think of a heart attack. So we want to talk about those warning signs today so that you don't ignore it, you don't ignore it in yourself, you don't ignore it in your loved ones as you see them with these symptoms. So the very first warning sign is, of course, chest pain, right? Some people have what we call the crushing chest pain, where someone will grab their heart and they will become diaphoretic, which means they're pouring sweat, and we immediately know, uh-oh, this person is having a heart attack. But not everyone presents like that. In fact, most diabetics have what we call a silent heart attack. They do not feel any chest pain at all. The only thing that they might notice is they feel a little lightheaded, they feel a little dizzy, and that's all the symptom they have. And when that is not taken care of, then they might start to have some nausea or some vomiting that would then prompt us to maybe call 911 and then maybe eventually get them some help. But if you are a diabetic or a female experiencing unexplained sweating, unexplained shortness of breath, unexplained nausea, these are things that we have to consider and immediately call your doctor and get checked out, because it doesn't have to be a crushing chest pain to be a heart attack. Okay, so let's talk about shortness of breath. Why do people get short of breath when they are having a heart attack? Well, because the lungs is one of the areas where you're going to be deficient in oxygenation, right? You're not able to oxygenate a lot of your body areas, including the lungs. So you're going to experience that shortness of breath because your body is trying to signal, hey, enough oxygen is not getting in here, I need help here, right? So that's why you're going to feel short of breath. Hope this makes sense. Please comment in the section below so you can help somebody. I'll see you on the next one. Have a good one.